This is one of the first videos that we are utilizing to talk about cultural diversity in United States hospitals. Understanding diversity in culture is one of the many components of creating an ethical approach to patient care. The topics for discussion are core cultural values and beliefs, medical ethics, healthcare and culture, and how these all relate to patient care. Our cultural formation plays a significant role in how we perceive the world, healthcare, and the ethics of the healthcare being provided. Most, if not all, of our perceptions are influenced by the culture that we come from. Even though we may assimilate into a new culture, our core beliefs remain with us for our entire life. Culture is the combination of customs, traditions, symbols, values, phrases, and other forms of communication by which we belong to a community. The traditions that we are raised with often dictate what our cultural customs are. These traditions tend to be ingrained in us for the rest of our lives. We are born into a culture and then learn how to think and behave within it. No matter where you later move to, the culture into which you are born and raised will have a lifelong influence on your values. People working in foreign countries retain the culture in which they were raised. These values, or culturally learned tendencies, can influence communication among members of a diverse group. People's ideas and actions about what is happening and what might happen are based on a personal experience or familiar cultural pattern that influences their actions. As healthcare workers, we need to understand that we have a small circle of control when working with a patient. There are also circles of influence and circles of concern. All of these impact patient care. In providing health care for a diverse population, we may find that American values sharply contrast the values commonly held by people of other countries. To provide better health care, we must get along with people from other cultures. We need to learn, listen, and respect differences. Beyond a diverse patient population, we also have a diverse healthcare provider population. Healthcare providers may have cultural biases and not even know that they exist. For example, someone born in the American or United States culture may not understand that the concept of equality makes Americans appear strange to the other 7/8 of the world. There is more than verbal communication involved. There is the fact that people have different beliefs ingrained from childhood. The majority of the world feels quite differently about equality than the American population. To them, rank, status, and authority are more desirable, even if they personally happen to find themselves near the bottom of their social order. The equality concept often makes Americans appear strange to others. Concepts differ country to country for individualism and privacy. We value individualism in the United States, we value privacy, and we like our personal space. This is not true in many other countries. Individualism and privacy are concepts that are often hard for different cultures to comprehend. This lack of comprehension or lack of understanding of the significance to different groups of retaining their cultural identity can lead to racism. If you find the hospital system in America confusing, think about how disorienting it is for people from different cultures. The bureaucracy and chaos at an American hospital facility is oftentimes confusing for people of different cultures. New sights, new sounds, and different smells can be overwhelming. Another major barrier is how different cultures view getting sick and illness. Successful treatment of patients requires that their beliefs concerning the causes of illness, how illness should be treated, and how it can be prevented in the future must be acknowledged. You may not believe that a bruja or a witch put a curse on the patient that caused the illness, but the patient may firmly believe that. Incorporating the patient's beliefs is part of the healthcare treatment. In a society characterized by pluralism, where the meanings of various behaviors and practices are as diverse as the people demonstrating them, incorrect assumptions easily lead to miscommunication. Without communication and understanding, the patient care process becomes extremely difficult. The problem with communication is that people harbor certain beliefs, assumptions, attitudes, and values that cause them to interpret messages as they listen to the words in their own perspective. Miscommunication is clearly when two people think that they understand the same problem or message, and each of them has a totally different perspective. Miscommunication can lead to racism. Racism is about the abuse of power by one group or individual over another, against whom they are prejudiced. Often patients see healthcare workers as having overwhelming power and authority. When patients see how they're being treated or their perception of the treatment they are receiving and feel that it is not what they should be receiving, they often feel they're being discriminated against. They may feel, although incorrectly, that the healthcare worker is racist. The real problem is not racism, but miscommunication. This series will focus on differences in culture and differences in understanding what causes illness, how illness should be treated, and how illness can be prevented. Healthcare workers need more training in cultural diversity to be able to provide better healthcare for all patients. The hospital environment is often stressful and chaotic, which is actually counterproductive to communication between peoples. We need to put the pieces together and understand how we can communicate better and provide health care to all people. This is the introductory video for a series, Healthcare Practices and Cultural Diversity.